Erectile dysfunction is defined as the consistent inability to maintain an erection sufficient for intercourse. To sort of simplify that definition, I ask guys, are you as hard as you want to be for as long as you want to be? And if the answer is no, then we say you've got some sort of erectile dysfunction. And it's important to note that one person's erections and another one's can't be really compared, as guys are happy with different levels of erections, and so it's important to make sure you're happy with your erections. Erectile dysfunction is incredibly common. About half of guys over the age of 40 have some trouble with erections, and to be honest, we don't talk about it enough. Anything that affects your health can affect your erections. The most common causes are diseases that affect your blood vessels, such as high blood pressure, high cholesterol, diabetes, being a smoker, or having some sort of treatment for prostate cancer can sometimes affect your erections. Erectile dysfunction is diagnosed usually based on history alone, meaning we just talk to our patients and find out how they're feeling and how their erections are. Erectile dysfunction can certainly be prevented to a large degree. Maintaining a healthy lifestyle with a good diet and exercising regularly, avoiding smoking, avoiding alcohol, all of those things can sort of decrease your risk for erectile dysfunction. That being said, there are plenty of healthy guys who still can develop erectile dysfunction just because they're getting older. There are many benefits of seeing a specialist that focuses on erectile dysfunction. Firstly, instead of just treating the erections alone, we look at you as sort of an overall human being, an overall man, and look at other health conditions that could be contributing to the erectile dysfunction and make sure we're not missing anything. In addition, specialists can offer you treatment options beyond just the pills that are available to everyone. They can offer you options for when pills don't work or you're not happy with the solution. Treatment options for erectile dysfunction vary depending on the severity of your erectile dysfunction and what other medical problems you may have. They can include pills that you can take prior to having an erection, penile implants, which is a small procedure that can help you get erections again, or injections that can be taken prior to wanting an erection. There are also vacuum devices and other small medicines you can put inside the tip of the penis to help you get an erection. In the end, we don't actually determine which treatment is right for you. You end up making that decision yourself after we give you all of the information. We'll tell you about the risks and benefits of every single treatment, and we'll put that in the context of you, what you're trying to accomplish, as well as what other medical problems you may have and why some things may be better for you versus others. At the end of the day, you'll make the decision. Satisfaction rates for different treatment options vary. For example, with the pills, it's difficult to time sometimes. You have to take them about 1 to 2 hours before you want to have sex. With the injections, similarly, for some guys they work great, some guys they don't work at all. With the implant, after patients recover from a procedure, satisfaction rate is pretty high, and most guys say that they would do it again. There are a couple of long-term consequences of not having erections. Firstly, if you're not having erections, that usually means something else is going on. So we make sure your heart is okay, your cholesterol is okay, your blood pressure is okay, things like that to protect your overall health and decrease your risk of having a heart attack or stroke in the future. In addition, the longer you go without having an erection, you can get some shortening of the penis and lose some length over time. On top of that, it certainly will affect your quality of life as well as the quality of some of your relationships.